One of the things you need to look at is atrial fibrillation. You probably see it on, on TV a lot. That could be something that could cause you TIAs, and it can be very inclusive because it doesn't necessarily not doesn't have to be present all the time. It's an irregular rhythm that can come and go, and you may not feel it, so it can be undetected. It happens commonly in people with hypertrophic cardiomyopathy. It can happen in those individuals. So you do have atrial fibrillation. Yeah, so that could be the source of those TIAs if there are TIAs. If you don't have atrial fibrillation, if you notice, some of these, the theme is not every test has a limitation. So the way we diagnose atrial fibrillation is most people do an EKG. But again, when you do an EKG, it's a 10-second snapshot in a condition that can come and go. So when you take a 10-second snapshot out of an entire year, what are the chances of us detecting something, right? Yeah. So there are technologies that are available. There are monitors that are very, very small, almost the size of two matchsticks that are inserted under your skin in your chest, and they give you 24/7 monitoring of your heart rhythm, and they can work for about 3 years. So if individuals who have TIAs and we suspect that they may be having undiagnosed atrial fibrillation, especially people who have risk factors for atrial fibrillation, we recommend those because chances are, if you don't have AFib in 3 years, then you don't have it, right? So, but this is the best chance of detecting it, and the reason why it's important to detect it is you have to treat it differently. Certain medications, blood thinners that we have to use to reduce the risk of stroke, and AFib is one of the most common risks of stroke in individuals over age 60. So that's one thing to look into if you're having TIA.